Welcome, everyone, to a wonderful new endeavor for the Yosan University podcast. My name is Sean Trace, and on behalf of Yosan University, I am interviewing a very interesting guest. Now, can you introduce yourself, tell people who you are and what you do?
Well, my name is Dr. Paul Magarelli. I am a reproductive endocrinologist and infertility specialist. I kind of specialize in integrative reproductive medicine. I've done quite a bit of research looking at the interface between acupuncture and IVF and in vitro fertilization. Was instrumental in starting the American Board of Oriental Reproductive Medicine, as well as starting the program at Yosan to teach doctoral students in integrative reproductive medicine, and been doing that for about 15 years and continue to do it.
That's really fascinating.
My wife is a traditional Chinese medicine doctor, and it is she and I who, 1999 met. By 2001, started doing research combining Western and Eastern medicine, and by 2003 started publishing year after year on the topic of IVF and acupuncture and the things that can and cannot be assumed from it. And no, honestly, I came begrudgingly to the field of integrative medicine. I was Duke trained and UCLA trained, so I was very skeptical.
Yeah.
And through a very rigorous 8 or 9 years of research. Research led to romance. I ended up marrying my wife and now wife, Diane Credenda, and that's the story. I still remain a entrenched Western medicine doctor who can spout words like, Shen and, Qi and those kinds of words. But in truth, my goal is to bridge, force myself to understand the Eastern medicine, and then at the same time, my teaching style is to get the traditional Chinese medicine doctors to bridge the Western, and then we find what I call one medicine, which is really the medicine of, helping people achieve, in my case, fertility.
That's really interesting. Now, can I ask you this? Can we go back a little bit? How did you find this link? You said you begrudgingly came to it. Was this something that you started seeing people, your patients were coming to you and asking, "Hey, doc, does this work?" Or how did it come to the forefront of your attention, to say?
Diane came to my office and said, "Hi, my name is Diane Credenda, and I think acupuncture works." And I said, "Well, as long as they pay you in chickens, you can do whatever you want. But if you're going to take money from my patients, you either send me the data or thank you very much. My patients are vulnerable." And so from my standpoint, they would do anything to get a baby, and therefore they will do everything to get a baby. And that, I feel it's my ethical and professional responsibility to vet. And I said, just bring me stuff to read, bring me some data, bring me some science, not knowing that she would. And she came back again and again and again. And at one point, she gave me a couple of papers, one by Paulus, one by Steno Victorin, which really are the forefathers of the field of the integration of IVF with acupuncture. And then she said, not much more, but then after a while, I felt compelled to send her patients that simply I couldn't succeed with. And she took care of them and actually sent them back pregnant rather than sent them back ready to get pregnant. And then pretty much I said, okay, this looks real. Let's do a rigorous Western-style research protocol, which I designed and contractually required people to follow a very specific protocol that Diane designed. It's now called the Credenda Magarelli Acupuncture Protocol, but at the time it was just a designed protocol. And we just began doing the research, and 3 to 4 years later, we unlocked the data because I felt there was too much bias in the literature. So I actually didn't know who was being treated, and she didn't know what they were being treated for. And when we unlocked the data, it was remarkable. And that drove us to continue our collaboration. And we've since spawned quite a, there's 1,000 board members of the American Board of Oriental Reproductive Medicine. I've trained over, I think, 60 doctoral students at Yosan. And currently, I'm the chairperson, co-chair of the Integrative Reproductive Medicine program in Yosan.
That's just really fascinating because I know that a lot of people, there are a lot of people who are hesitant about Eastern medicine, and acupuncture because sometimes, like you said, the terminology can catch people off guard. You didn't say that, but I'm saying that you had talked about some of the terminology like shin and things like that, and some people are like, is this real? And what in your perspective, is there more research being done into it besides just through fertility medicine? Are there other areas that you've heard of that this is being looked
Oh,
at?
well, since China's come into a capitalist society and they are very rigorously wanting to be part of the national stage, a huge amount of literature is coming out of China, looking at sort of a Western approach to diseases, etc., with either combined or contrasting various protocols. So this, and looking at the molecular basis for herbs, as well as the science behind the pathways associated with the actual acupuncture channels. I
Mm,
mean, as a research scientist first, which is where I started my career, and a physician second, it's really easy for me to dive deep into that and feel comfortable. And I would really have to compliment the literature from China. It's not certainly coming out of the United States. I think Diane and I's work really still stands as the model science uh, in sort of a Western perspective. I really don't know of any other authors who. Now, there have been people who have been dilettantes. They've stepped in and then stepped out because it was in vogue. But
hmm
really, Diane and I, and members of the American Board of Oriental Reproductive Medicine, members of, well, actually, the doctoral students have done a very good job of
yeah,
asking some fundamental questions and doing their capstone projects. And my job is to get those published, help them get those published because, quite frankly, they're excellent. The hardest part is that in my field, we've made such strides with pre-implantation genetic testing and with egg and embryo freezing and with protocols. The fundamental differences that I noted in 1999 to maybe 2009 have sort of been. It's hard to find those major differences that we demonstrated because we've gotten to, instead of 30% pregnancy rates, we're now at 60 or 70, and it
mm,
gets harder and harder to show subtle differences. That does not take away the fundamental principles that we understood or unlocked in how acupuncture works, but it's hard to motivate people to continue down that pathway because it's a law of diminishing returns. They're not
that is
getting the major jumps. And to be quite frank, when I first started, Diane and I first started, there were maybe 2 programs in the United States that supported acupuncture with IVF. And now, of the 500 of them, in one way or another, tell their patients either we have acupuncture, go to acupuncture, we won't stop you from going to acupuncture. So, um, so not as much can we expect to see significant jumps. Now, where I think we can is in syndromes, because with traditional Chinese medicine, you call it differentiation of syndromes, we call it,
yeah,
a differential diagnosis, and syndromes in Western medicine means we don't know what the hell's going on.
yeah,
That's what it means. We say disease when we know, and syndromes when we don't. And so the the key for us is to convince our doctoral students to pursue other issues other than IVF outcomes. That to me is the challenge. Management of male factor infertility, endometriosis, fibroids, PCOS, polycystic ovarian syndrome, recurrent pregnancy losses, huge areas of of open canvas, blank canvas that I think traditional Chinese medicines can paint with Western medicines if they join up to produce some fundamental novel approaches that will ameliorate some of these diseases or syndromes.
Do you see any movement in that direction at this time, or is this something that is just beginning to
Well, I've
open
got
up?
some students. I've got some students who are doing, studies with male factor infertility, and I'm helping them get funding because funding is always a difficult thing in traditional
Yeah.
Chinese medicine. The needle companies and the herb companies don't tend to fund research, whereas pharmaceutical companies, of course, will. Um, I think educating them. I think it's hard to say because I don't know the educational sources
Yeah.
for pursuing academic pursuits anymore. I
Yeah.
don't. I don't know if, I know that NIH is interested in areas of pain, and pregnancy. I know that certainly the Chinese companies are looking at maybe we can get the fundamentals from the herbs, but that just becomes a drug company.
Yeah.
Once you start distilling out what it is that the herbs are doing, you're going to do like everyone and try to crystallize it or distill it to its essence, which then changes the whole methodology of Chinese medicine as far as I know.
How did you get into medicine? How did you find your path as to becoming a doctor?
Well, I'm a world authority on shrimp reproduction.
Really? Really? That's
Yeah,
that's
yeah.
fascinating. Tell me more about that. That is amazingly fascinating.
Well, my whole life I wanted to be a marine biologist and
Really?
started in aiming in that direction. Spent a little bit of time with Jacques Cousteau's son out in New Guinea. Went down the pathway from my master's and PhD in researching marine animal reproduction, and then worked in Hawaii at the Oceanic Institute, doing basically basic research to create protein sources on on islands in the Pacific, using recycled waste products from farming to grow protein and marine protein, and got $1 million grant from the USDA and realized that I was bored to hell, and that all I was doing was sitting and writing grants, and all my PhDs who worked for me were doing the research. So I decided to go to human reproduction because I wanted to learn human reproduction, not thinking I would be a physician or anything, but that was my approach. And I fell in love with obstetrics and gynecology, which is the foray into reproductive medicine, and just went down that pathway. And reproductive endocrinology and infertility is a subspecialty under obstetrics and gynecology, and kept going down that pathway. And being an entrepreneurial person, I started developing companies. One company was working with a Chinese conglomerate to do IVF, international IVF, which was working with folks in China and the U.S. and essentially spent quite a bit of time in China and then back and forth. And my own companies have mutated, or I should say evolved, not
Hmm.
mutated, but evolved into different areas. And now I'm working with I guess one of the largest private equity companies in the United States called Kindbody, and it's a over $1 billion company that specializes in creating fertility options for essentially with a woman's touch, with with enterprises like Walmart and Tesla and other major companies to create avenues for health access. My biggest desire is health access, and health equity. And so right now, for me, it's using all of my experience to help train and prepare the next 2 or 3 generations of reproductive endocrinologists and acupuncturists to work together towards creating this one medicine that I envision as the best way to approach fertility.
That's actually amazing. That's just really interesting. From that whole story was interesting, from the expert on shrimp reproduction all the way up to this journey you've had. Now, there was something that earlier that you had mentioned that I'd love if you could talk a little bit more about that. You had said that your patients were vulnerable, and that these were people who would do anything. Can you talk a little bit more about that? Because that's, to me, is something that I think a lot of people don't always think about, in medicine, because this is a very vulnerable area that people are looking at.
Yeah, identity, and we define ourselves by our culture, by our families, by our society, by our interactions, by our experience, and the the keenest definition is boy, girl, man, woman, boyfriend, girlfriend, mother, father, um, and defining those defining both behaviors and biologic imperatives drive us. And if they didn't, we certainly wouldn't be here as a species. If we don't recognize that, for many, their whole identity as a woman, using the woman in this example, not so much the man, but the woman, unable to achieve motherhood when they've defined that as their primary function, doesn't mean it's the only function, but in that, our culture and our evolution and our basic humanity defines that being a mother is critical to the perpetuation of the species. So that's sort of biologically driven, not for all, but for most. That once you break that bond with the assumption, which all of us, especially in the Western part of in Western civilization, which is fertility is easy, contraception is what you do. Once
Mm-hmm.
you break that to fertility is extraordinarily difficult, and quite frankly, you may or may not be a mother, a desperation ensues, and
Mm-hmm.
you become desperate for solutions, and you'll do anything. And anything, I mean anything. So if I ask you, and people have done this, stand on their heads for an hour in the corner because they think the sperm will pool better in the cervix, they'll go stand on their heads in the corner and pool the sperm after intercourse, or raise their hips, or put their heads, their knees behind their head, or what have you, whatever it takes. And so once you know that, that means they're vulnerable to any suggestion, especially if you're wearing a white coat and a stethoscope, or you're looking like an ancient Chinese philosopher and you have needles in your hands,
Mm-hmm.
or you give them decoctions that taste like crap, but you tell them it's some sort of dongui, or some solution of snake venom and a combination of bat wings. They're willing to do anything if it's going to bring their fertility to enhance their fertility. They also blame themselves typically, rather than understanding that it's a 50-50 deal between the man and the woman. And so you have to be cognizant of that. You have to look at them with a third eye when you're talking with them, and watch how they're calculating, how do I manipulate this situation to get me a baby? And at the same time, what we've done in America is made fertility a cost as opposed to a benefit of health insurance. So,
Mm.
typically when you break your arm, you have no doubt you can if you have insurance, you'll get a cast, and you get to the emergency room and no one's going to say anything, and you do your copay and you'll walk out. Well, typically in the United States, and sorrowfully in the United States, it's a 10, 15, 20, $30,000 proposition.
Mm-hmm.
And if you haven't looked at the economy, people don't have 30,000, 60,000, 90,000. Typically, sitting that they could fritter away on a 50% chance of achieving a family.
Yeah.
So every aspect of what they do, you have to, I believe, I have to, using my science background and my medical background and simply my crazy ingenuity or my MacGyver type approach, figure out a way to optimize. And one of the ways is to enhance their fertility by removing some of the blocks that traditional Chinese medicine can do through understanding their constitution and their basic problems with qi and with their own constitution in terms of things they're doing to block the normal flow of qi and health and wellness. I believe a healthy body is a fertile body. So I
Yeah.
can't do that in a Western model because we don't have time. But traditional Chinese medicine physicians have the time to create the lifestyles to support, as long as they feel they're supported by the
Yeah.
Western establishment to provide those services and work in conjunction and collaboration. Um, so you know there are, as we all know, with social media, Google, and a variety of other things, manipulation is easy.
Yeah.
Manipulation is easy. So that's where I come very strongly about show me the data, make sure you have a cogent line of reasoning before you tell a patient something like acupuncture will get you pregnant. I've met with many masters who have said, oh, 100% of my patients, these are traditional Chinese medicine doctors, get pregnant when I treat them. Well, yes, if you have an N of one or two people, then maybe that's true. But when
Hmm.
you're dealing with millions and millions of people, it is illogical and just disingenuous to believe that whatever treatment you have is 100% curative, because quite frankly, that would say your medicine is perfect. And I haven't found the medicine that's perfect. Now,
Yeah.
I can go on and on about this, but I'll,
No,
I'll
no, it's
stop
it's
there.
fascinating.
Yeah.
It's fascinating.
Yeah.
That's really fascinating. Well, what would happen? I want two lines of questioning that are really interesting me. That now a patient comes to you. What's your standard procedure to really find out what's going to help this patient the most?
Well, my wife says I have curbside instead of bedside manner. And so curbside manners, is really straightforward. And, do you have eggs? And that's a blood test.
Hmm.
Do you have sperm? That's a semen analysis. Can the sperm and egg meet? Are your fallopian tubes open or not? And that's a procedure. And is the uterus a safe place for the baby to grow, which is basically another procedure to look at the inside of the uterus? Are there hormones that are out of whack or in disharmony or just simply not in the normal pattern of secretion that are interfering with ovulation or stimulation or both? Are there substances in your life or things in your life that can interfere with? And some people actually don't know when to have coitus and simply don't know about fertility. So there are some
Hmm.
basic things that we can help you with regards to how fertility works. Um, are you maintaining a way of living that doesn't interfere with your body's curative or or normal functioning? Not getting enough sleep,
Right.
taxing the system with food choices that create insulin resistance, which in turn creates obesity, which in turn changes the hormonal milieu of both the male and the female. Are the men, pushing themselves too hard, stressed, alcohol, tobacco, drugs? Are people using substances that they think are legal but not necessarily health affirming, marijuana, different kinds of street drugs? Even men would think, unfortunately, and it's a sad thing, that adding testosterone to their way
Hmm.
of life through legal and illegal means, that creates sterility. Yes, you have a great heart on, but quite frankly, that's not a measure of fertility. Sperm is a measure of fertility. are the women, at the point where they're anorexic or they have not adequate amounts of stored fats, so that they're shunting away both through stress and through malabsorption, or even worse, through just simply poor metabolic pathways, the hormones necessary for reproduction to the corticosteroids or the glucosteroids as a way of managing those things. So, you can quickly and efficiently figure out about 85% of the reasons why folks are infertile. And then you have to go down the pathway of, okay, do you have a maternal historic precedent for poor low ovarian reserve, because your mother's ovarian reserve is which is given to you through the X chromosome, and so therefore, are there things outside of your control?
Mm-hmm.
Um, and so in a nutshell, it's not a nutshell, but it's sort of the way I think through these things.
Well, there's a lot going on there, and it sounds like in the first part you got to put on your Sherlock Holmes hat, find out what's going on, and then, like you said, then you switch to MacGyver, where you're trying to figure out a pathway forward.
Yep, that's
Well,
exactly right. And and patients want results and they want them quick, but at the same time, because of the denominator being the cost of the procedure,
yeah.
that angst, that Herculean shift of being unable to afford but unable not to be a mom, I don't envy it. I don't envy it.
Yeah.
That's a terrible conundrum.
For the students at Yosan, what can they expect to get from studying in these classes with you?
Well, the key thing that Yosan does, and that's thanks to really Dr. Dao and Mao, their approach, which is a blending of traditional Chinese medicine with Western medicine. Dr. Robert Hoffman, who's now the chief academic officer and a PhD and a researcher and a very focused individual on creating doctoral level educational opportunities. The key thing about Yosan is that there is a huge diversity of instructors. There's a real keen focus on academic pursuits, not for the sake of academics, but for the deeper understanding of both classic Chinese medicine as well as the interface between traditional Chinese medicine and Western medicine. They can expect like some very long and arduous and days of education. My typical courses are 15 hours over 2 days,
Oh wow.
so they are entrenched. It's exhausting but fun. They can expect to be challenged in class to think and to dynamically integrate the information that they're learning rather than passively absorb and regurgitate it on an exam. I will not accept that as a learning atmosphere. Um, they can expect what I find is they can expect from the administration, especially since Robert has taken over, Dr. Hoffman, is to be heard, but to be directed
I
and
love that.
to be given opportunities to do research. We work very hard. I've created an externship program for the doctoral students in women's health, where they will be able to spend up to 4 or 5 days at an IVF center, understanding every aspect of IVF, which is pulling up the curtain to see the Oz behind the IVF program. And they will get not a hands-on, but a very a real exposure to what's going on, so they understand what their patients are going through. They could expect that I will expect them to become part of the American Board of Oriental Reproductive Medicine and hone their skills by being part of a 1,000-person community that's rigorously approaching their medicine. and a perpetual learning experience. We are going to be creating many opportunities for continuing medical education. We are putting on our Women's Health Symposium in March, and we have some of the best minds in the field coming, speaking at this symposium. We hold it annually. So I think, and they can expect that I will be available to them for the rest of their lives to answer questions regarding their patients and regarding what they're learning or questions they have about the field, because that's my dedication as a professional to their profession.
That's awesome. Well, Dr. Magarelli, I want to thank you for your time today. This has been super insightful. Are there any last words that you'd like to share with anyone who might be listening to this?
Well, yes. Don't be afraid not to know, because that's the only avenue to desire to learn. That learning is never linear. You're going to go
Yes.
in fits and spurts, and you're going to be confused, and then you're going to have a great awareness, and that awareness is then going to be challenged. And don't be afraid. Um, Ever, always ask for help and be part of a community. That's the only way the whole of the medicine will proceed. And be a person of integrity. Know what you know what you don't know, and don't be afraid to distinguish between the two.